Good.
All right, we're here at the Piedmont Regional Dental Clinic, here on our day to serve veterans, and here with one of the resident dentists. And so, Dr. Jack, just wanted to ask, what caused you, or what interested you in joining the military, and what branch did you serve in?
I guess family ties. I had a grandfather who was a dentist,
Okay.
and I sort of grew up in that realm. While I was in dental school, I became interested in a continuing education program, general practice residency that were sponsored by different schools, colleges, military, VA. And I applied to the U.S. Air Force, which had a program that really met my needs. And luckily I was accepted into that program. I had spent my whole life in Virginia, and my duty post was in Texas, which was a big experience for me and my wife. So from 1968 to 1969, I was in the Air Force general practice residency program, and went through all different phases of dentistry. Probably our program was a little different in that we were tasked for about 3 months in a hospital situation environment. And at that time, the war in Southeast Asia was really starting to ramp up. We were getting a lot of young kids and older service members coming back with all types of medical and dental problems. So I felt very lucky that I could see it from the medical perspective as well as the dental perspective. So saw all kinds of different war trauma and mental problems, and it was an eye-opening experience coming from a sheltered dental school environment. My next tour of duty was active duty with the Air Force, actually in Selma, Alabama, small pilot training base. We trained Air Force pilots, Marine Corps pilots, and Iranian pilots, because the U.S. at that time was still on good terms with Iran and the Shah. Of course, when the Shah fell, so did that relationship. So, spent 2 years there, off and on again, temporary base dental commander. We did a little bit of everything. Finished up my tour there and came back to Virginia, and we settled here in the Piedmont.
Very neat. Very neat. What was one of your favorite parts about serving?
Well, I think, one, it was eye-opening to see the problems that existed with service members, veterans. We had a small contingent of veterans that we were allowed at that time to treat. So early on I started seeing that active duty, reservists, and veterans had a list of problems that were not being met. So that sort of started me on that road. In our dental practice, which next year will be 50 years for me,
That's awesome.
we have a small interaction with service members. Some retirees, some active duty reservists, and that kind of thing. So along the way we see different problems that exist, but that population is really no different than general population. They don't brush their teeth, they have gum problems, they have cavities, they need extractions and that sort of thing.
Gotcha. Gotcha. Well, what's special about Veterans Day to you?
Well, it's an organized way to treat those who served for us. And Piedmont Regional, 4 years ago, started the program of Veterans Day treatment for those who met the criteria. And it's been well received. It started off a little slow because nobody really knew what to expect. But once we got organized, word got out, it's doing what it was intended to do.
Good.
So we're treating a fairly good population of veterans.
Good, good. Well, I think that's